Deukmedjian, CEO and founder of Duke Spine Institute. Today is June 23rd, 2020, and we have just finished our first surgery a little while ago, which was a lady who had a fractured C2 called an odontoid, type 2 odontoid fracture. Years ago, it never fused, and she got into another car accident, and it caused some loosening of the hardware, breaking of the wires that were in there. So I had to go in and revise her fusion and get some of her old hardware out. She's doing great. She's in recovery. We're going to check back with her in about 30-40 minutes. In the meantime, we're going to do a Duke laser disc repair. This is an endoscopic laser spine surgery. This is for back pain and leg pain. Back pain at L5-S1. This is the small of the back, basically where the belt rides. Second most common disc to herniate, L5-S1, the first being L4-5. And this patient has had back pain for 5 years. 5 years she's had back pain. And she's just learned to live with it, and she's suffered with it for 5 years. It's gotten worse, and then about a year ago, it started going down her left leg. And now she can't even get out of bed. She hasn't been able to get out of bed because of back and leg pain now for about a month. When I interviewed her, she was in bed, and she's now here to have Duke laser disc repair. That's endoscopic laser disc repair of her L5-S1 disc herniation. My goals today are to get rid of her back pain and her leg pain. There are millions of people in the world suffering with chronic back and leg pain that's curable now. It's not curable everywhere, folks. You have to go to the right place. And Duke Spine Institute is a leader in the world, #1 at curing back and neck pain. No one else will tell you they can cure your pain because they can't. But we do it here all the time. This is a new paradigm, a shift, a change in the world of medicine and healthcare to be able to cure back pain. All right, we're going to get started. Our patient is awake. This is Dr. Deukmedjian. We're going to get started. That's my hand on your back.
Got it.
It's important you lay still.
Okay.
Don't pick your head up, but you can talk to me. I can hear you. And the anesthesiologist will tell me what you're saying. All right? I'm going to put you to sleep in a few minutes, but before I do that, I need to numb you up a little bit, and I need to get to your bad disc, so I need your help with that. If you feel any pain, just say ouch.
Okay.
All right? Say it for me once.
Ouch.
Perfect. When you say ouch, don't lift your head up. When you say ouch, it tells me to give you more pain medicine, okay?
Okay.
All right. But don't move your body.
Okay.
Promise? Okay. I'm just feeling around. That's Dr. Duke here. I'm just finding out where your iliac crest is. Okay. Are you ready to get started?
Yeah.
All right. Now, you're not going to like me because I'm going to give you a little poke, and that's normal, to have a little stick and burn. That's just the medicine going in, okay? Yep, I know. I'm sorry about that. It'll get better in just a second. Just relax. You're doing great. Yep, you're doing great. I promise. All right, so she's getting some local injected. We use Marcaine, lidocaine, a little bit of epinephrine. You better?
Yeah.
All right. You're doing fantastic, by the way. I'll let you know if we're having any problems. I don't expect any problems. 7 cc's injected, doctor. How's our blood pressure? Perfect. Let me know when you get it down. 110, maybe. Below 120, systolic. Are we good? Wait a little bit. All right. So I'll talk to our viewers. Let's see the MRI, folks. What can we do with that MRI? Why don't we scroll, other way, and stop there. Maybe one more click. Let's see what that brings us. That's too hard to see. Go the other way. Nope, go back. Stop there. That's good. Sean, do you want to try to zoom in on the MRI? We're going to have to move the light will you grab this light? Do not, yeah, just grab it and pull it like away from the field because he's got to get a shot. We need to cover the patient's name. Go ahead and erase the name. Erase it. Perfect. And then on the MRI, we need to make sure the name is not shown on the MRI. Just use a sticky or a Post-it or something. All right, you good? There's no other name on there, right? All right. You want to try, Sean? Let's look at the MRI and zoom in. And go ahead and take the arrow, the white arrow with the mouse, and bring it down to where the herniation is and put it just below the herniation. Yep, keep going. Right there. A little bit lower so it doesn't block the herniation. A little lower, lower, lower. Right there. No, too far away. Right about there. All right, good. Can you see that?
Yes, we can.
You see the little pointer?
Yes, we do.
The pointer is right below the bulging or herniated disc at L5S1. Can you see that herniation there? That herniation is what we're going to fix with the laser surgery. How are we doing on blood pressure?
Working him down.
All right. Are you comfortable?
Yeah, just don't feel good.
Your back's bothering you?
Just
All right, just relax. You're going to be just fine. Num num. Remember our deal, okay? If you're feeling uncomfortable with any pain, you just say ouch, and I'll take care of it for you, all right? Fair enough? Just lay still.
Okay.
You're doing great. No, you're doing fine. Just lay still. Yep, I'm giving you some more numbing medicine. Shot. All right, let's go with a lateral view. So for endoscopic spine surgery that's done transforaminally, which is the approach that I use, transforaminal approach was first described by Parvis Camden out of Pittsburgh. Let's clean up L5S1, please. You're pretty close, but I think we could do a little bit better. I think a little bit of wag, a degree or two at most. Dr. Parvis Camden now, I think that's worse, was a surgeon, an orthopedic, I believe, or possibly a neuro. I can't remember which he was, but he was practicing surgery medicine at, that's perfect, in Pittsburgh, and developed a technique of coming from the side rather than every other surgeon would go to treat the disc problem through the center of the back, right in the middle. But Dr. Camden said, hey, why should we go this way and remove all that bone that's in the way before we get to the disc? Because that's just weakening the spine. Let's actually start way out here and work our way towards the center of the spine where the herniation is, okay? That's what Dr. Camden did. He developed the transforaminal approach. Shot. Now, his technique wasn't great. You're doing good. Just relax. Shot. And unfortunately, it never got popularized with him. So it was taught to a few people. Shot. And those doctors modified it. And one of the doctors that modified it was a doctor in Korea, Dr. Sang-Ho Lee, and a doctor in the United States, Dr. Anthony Young. And of course, there were other doctors too, like Dr. King in England, and a German doctor. And those doctors modified it so it was a little bit different. Anyway, I learned the technique and I modified it as well and made it into the Duke laser disc repair. All right, shot. Let's see where we are. So we're right at the facet joint at L5S1. Our trajectory looks perfect. We just need to be a little bit more lateral. Shot. Shot. Are you comfortable? Just lay still. You're doing really good. You don't want to move around. We're going to be done very soon. Shot. You're doing really, really good. I know this is uncomfortable. We're going to put you to sleep in just a minute, okay? Not quite there. Shot. Are you comfortable?
Yeah, my legs are really heavy.
All right, Sean.
My
Try not.
leg is hurting really bad.
Which leg?
My left leg.
It's hurting bad already, though, right? Not right now, but
Oh, it's burning.
you feel burning?
Yeah. Lots of burning. Fire.
Is it better? Is it better?
Not yet.
Hmm. Now, has it been bothering you since you've been laying here?
No.
No?
No, it bothered me a couple days ago.
But I mean in the last 15, 20 minutes, it's not been bothering you?
No, it just started bothering me just now.
Okay. All right.
I'm sorry.
No, you're doing great. I promise.
Sorry.
This is why you're awake. This is why we need your help. We need your assistance to do this. Sean? All right. Just stay still. You're doing great. Sean? So I'm coming in a little bit lower. Comfortable?
Okay.
I wonder if we need to do something here with our rotation. Let's turn this light. This light is kind of right in my eye. I'm trying to figure out. Maybe turn this light off. Yeah, off. Okay, that's better. That's better. All right, so let's try some wagging and see what happens. We've got a little bit of discrepancy on our sacrum and on our iliac bone. That's a little bit better. I think that's a little better, but you're too low now. So we're getting the hip joint. We don't want that. So I want you to, let's get this arm out of here completely. Either swing it more that way north or pull it just completely out towards you. Thanks, Cam. Don't bump anything. You can push it up. There you go. Nice and slow. You got it. Perfect. All right. Good. Let's not have that there, please. That's our latest picture. All right. That looks pretty darn good. We still off a little bit. You move north or not? Let's move a little bit more north. Yeah. Are you comfortable? All right, good. Blood pressure's good. All right, so that's more north. You see right where the tip of the needle is? There's two black lines running down to the right. You want to try to get those lined up. I mean, you don't have to be perfect, but let's get it close. So try some wagging. It's actually better right there. Yep, that's good. I'm happy with that. Let's leave it there. Are you comfortable? All right. Shot. Give me an AP. We're almost done and we're going to put you to sleep soon, okay? I know you are, but I need your help still, just for a few more minutes. Everything's looking good. Everything's going perfect. All right, we just took an AP shot. That's anterior, posterior. Anterior is front, posterior is back. Basically a shot front, back. And the spinous processes are good. Our position of the needle is perfect. Let's go back to a lateral. You can see that we're at L5S1. Our target is L5S1. That's where the herniation is, L5S1 on the MRI. And that's where her pain is coming from. You doing all right?
So the pressure will be better when I put her to sleep.
Yeah, I know that.
You realize on that?
Well, where are you?
Going down to 130, 140. When I put her to sleep, it's going to be like more intense.
You feel that in your back?
Yes.
All right, shot. So we're just above the end plate. Where do you feel that? Okay. Just relax. Try not to move. It's all right. Shot. I'm sorry? Shot. done what I wanted to do, which was to come in, shot, a little bit lower, but I think I've come in a little bit lower than I want to come in. Shot. So we're going to try this one more time. Shot. And this time it's a slam dunk. Shot. Huh? Sam's happy. I'm happy. Luis, are you happy? Everybody happy? Have you watched this surgery online? Have you watched this surgery? You watched it online? Mm-hmm. Do you remember what we do next? I know, it's tough. I'm going to put you to sleep very soon. All right, have the propofol ready. And we can go ahead and put her to sleep as soon as I tell you, but not yet. All right, we're going to do our discogram. I'm sorry about that. Everybody heard that. That wasn't me screaming. That was her. We found your painful disc, all right? We're there. Was that your typical pain? How bad did it go to on a scale of 1 to 10? Give me a number. 100. All right. Well, when you wake up, that pain will be gone, miraculously cured. You're welcome. Go to sleep, all right? Let's do it. Count from 1 to 100. Count out loud for me. Start now. Keep going. Keep going. If you get to 100, we don't pay the anesthesiologist today. Your blood pressure's fine. Yeah, it's fine. You have a good anesthesiologist. He's doing a really good job. Keep counting. No, I'm not ready to do anything yet. I'm actually going to give her some more dye because I need more than I put. I put barely anything and she almost came off the table. So keep counting. Loud and faster. If you get to 100, I don't pay him. Come on. Count faster. Oh. Keep counting. All right, so I'm going to give her a little more dye, which probably will hurt and stimulate her and bring her blood pressure up a little bit. There we go. Good. Shot. All right, folks, you can see the dye is being injected in the middle of the disc, and somehow it's getting to the back, behind the bones. It's called the epidural space. The reason it is it's coming out through a tear, and that tear is the source of her back pain. That tear is the source of her disc herniation, and the disc herniation and the tear are the cause of her leg symptoms. So when we're done, we're going to repair the tear, and we're going to cure her back pain and her leg symptoms. Now, she will have numbness after surgery. Everybody does. Their leg is still numb because the nerve was pinched so badly. They have what's called a radiculopathy, and the numbness takes 3 to 6 months to go away. You see the guide wire is in place, so it's good. Right, Luis? You see a guide wire there? Shot. Just make sure. I'm happy with that. The guide wire is there. It's up against the anterior annulus. Now, I am not going to let this guide wire move. You don't want it to go in. You don't want it to go out. So you have to hold on to it while you remove the needle. Shot. That's my guide wire. Good. There's a big herniation there. You all see it? See the black stuff behind the vertebral body, how it comes down? And right where the guide wire goes in, it kind of does like a roller coaster or a slide. That's a herniation, pushing the dye backwards. So this lady has a big herniation. It's intraforaminal, and we're going to get rid of it. And somebody last surgery said, Dr. Duke, is this laser spine surgery? I said no. Or we said no. And he said, how come you're not doing laser spine surgery? You don't know how? It's funny. We are the world's leader in laser spine surgery right here. Ever since Laser Spine Institute closed, and by the way, Laser Spine Institute never did laser spine surgery. She's too much awake. Laser Spine Institute just said they did laser spine surgery. But my friends who worked there for years said they never used a laser. They basically just used a drill, and they removed bone from the spine, and they just did a microdiscectomy like everybody else does. So it's unfortunate that there was some false advertising with laser spine institute, but true laser spine surgery is done at Duke Spine Institute, and once again, we are the leaders in the world with respect to the best outcomes for our patients, having the best success rate of curing their pain, and safety. We had 0 complications so far and over 1,000 surgeries shot in 16 years. 16 years, no, 14 years, sorry. I started in 2006 doing the endoscopic laser surgeries. So that's 14 years shot. Now for those of you who don't know me, it's understandable. I'm a neurosurgeon, trained in the United States, trained at the top neurosurgery training program in the country in 1996-97 when I applied. That was the University of Florida in Gainesville. Shot. I trained with some of the top neurosurgeons in the world in their respective fields. In neurosurgery training in the United States, not all neurosurgery programs are the same. There are 120 programs, and each program has pros and cons. Ultimately, each program has to provide the residents with a certain educational experience, surgical educational experience. Shot? All right, we're right here. I feel the herniation, by the way. I'm pushing it in back into the disc. I'm going to take it out from the disc. That's the safest way to do this surgery. Shot? But my God, the tear in the back of the disc is huge. It's absolutely huge. I mean, this thing is just going right in. And the discogram is a little deceiving because it doesn't look that bad on the discogram, but that's only because it's so scarred up. Remember, she's had pain for 5 years, so this tear has been here for 5 years. Shot? Give me the hammer. Shot? Good. So the tear's been there 5 years, the body trying to heal it for 5 years. Well, all right, I shouldn't say 5 years. It's probably been longer than that, but she's had pain for 5 years. So let's just assume the tear happened and then the pain started with the tear. That typically is what happens. So she's had this tear for 5 years. It kind of healed a little bit, then it got worse. It never completely healed, by the way. These tears never completely heal. They're always going to be slightly weaker than a normal disc. And the fact of the matter is that most people who have a herniation don't have symptoms. That's because it's healed good enough that it doesn't cause any symptoms. But in 5% of the people with herniations, they end up not healing properly and they end up with chronic back pain and sciatica or neck pain and sciatica. Okay, we're in. Shot. The entire surgery is being done through a little metal tube, which you're seeing right now. Now you want this to be... Usually we give Toradol, right? I want to get her... Hello? I want to get her on oral pain medication. Have they given her Dilaudid yet? How long ago? How many milligrams? And it should be oral, not IV. When? All right. And I would do, if she had Toradol, IM, or IV?
I didn't give Toradol without your consent because bleeding was an issue.
Yeah, no, she can have it. We do it all the time.
Yeah, we can give her 20 of Toradol.
20 or more? That's kind of low, right? Or 20 IV? You want to give her any IM for longer lasting?
30 of Toradol IV.
All right, we're heading inside the disc, the bad disc that's been injured. Take it. And I want to pull it back just a little bit. All right, grab her. So we're inside the disc through this tube, and the tube is called the tubular retractor, and I'm using a scope, an endoscope, to see all the way down. Let's get the laser. Now we're going to use a laser, and this is laser spine surgery, true laser spine surgery, folks. Is this a new scope? No, that's coming tomorrow, you said?
It's coming today. So
Today.
probably from the front.
It's a little blurry, so let's see if we can sharpen up the...
You can go up to 50 or
Yeah, I really want to get her converted oral, because she's going to go home on oral. And just give breakthrough. Maybe just give her the Toradol now, IV or IM, whatever. That's fine. That's typically what we do for these patients anyway, right? For the posterior cervicals. All right, why do I have a black dot at the bottom? You see that?
We've also been doing IV Tylenol so far.
Yeah, IV Tylenol is okay, but she may have already gotten some Tylenol. She did get PO pre-op? The most important thing is that she's taking all of her pre-op pain meds. All right? Otherwise, we're going to get into a deficit situation. So she should be getting, good, all of her pre-op pain meds on the regular schedule that she always gets them. And then on top of that, we give our stuff for breakthrough, hopefully oral, and then back up with IV or IM. Do we have any questions from our audience? So this is a laser fiber, the blue thing. It's carrying laser energy bursts to the tip of it. Those bursts are transmitted out the end of this glass fiber here, and they basically go about 0.5 millimeter out, and then the energy is distributed and dispersed. And if there's a piece of tissue, like a piece of the disc herniation right next to the end of it, it'll zap it. If there's nothing near the end, it'll just get dispersed into the water that's floating, that's around the tip. You can kind of see there's some movement going around. That's all fluid, water basically, saline. Technically, it's saline. Now, when the laser emits a burst of energy, it does two things. It causes coagulation of the tissue, and it causes a pressure wave. So a pressure wave is emitted. That's why you're seeing everything move so fast. It's the pressure waves, the pulses. It's like a shock wave, basically, is what it is. That's one of the reasons I like this particular laser, is it creates a shock wave and it really loosens up pieces of herniation and gets them floating out of there once they're released through the coagulation process. There's a transfer of thermal energy and a transfer of pressure, a pressure wave. That wave is called cavitation. It literally is so much energy it cavitates the water around it and transmits that like a sound wave through the water. Creates a bubble. All right. Right now we're just removing the parts of the herniation deep inside the disc. The laser is a very efficient way to do that. what you're looking through, folks, is a rod lens configuration. Basically, a camera is sitting here where my hand is, my left hand is, and it's just projecting whatever it sees up onto the screen. And what the camera sees is an image at the tip of this endoscope. The image is projected with the use of a series of lenses that are housed within the center of the scope. And then, of course, we have a blue fiber here, a blue cable. You can't see it. It's on the outside of the patient, and that transmits light. So whatever's at the end of the endoscope here gets lit up, and then that lit up image is transmitted to the camera. Now this is going to be a more painful area for her, so she's going to start responding a little bit because we're out on the outer annulus. She's going to start feeling uncomfortable. So, oh yeah, no, I know. I've done many of these. I know what propofol does to blood pressure. The problem is when the blood pressure is high and we can't use the propofol. That's when I get more concerned. So you see why I need the patient awake in the beginning. If you get too close to the nerve root that's exiting through the foramen, the patient will have leg symptoms. Now she has leg symptoms normally because that's one of the things she presented with from the herniation, but we certainly don't want to make those leg symptoms worse. And having her awake helps guide me to the right place to get this herniation out without causing worsening of her leg symptoms after surgery. Huh? Yeah,
We have a question.
sure.
One of our viewers is wondering, what is the recovery time for this procedure?
Recovery is 30 minutes. And then you can drive the next day, you can go to work the next day, you can shop, you can go back to a normal life the next day. Patients will have a lifting restriction. You cannot lift over 25 pounds. No picking up anything that weighs more than 25 pounds. That's for 6 weeks. The very first 6 weeks after surgery. No lifting over 25 pounds. And no bending over at the waist to pick up things from the ground. So I've had about 1 in 100 of my patients that have the surgery. They're feeling so good. Within a few days they think they're back to normal, but they're not. They're back to normal feeling, but they can't be back to normal lifting. This disc is going to take 6 months to a year to fully heal. Stand by. And it's been trying to heal now for 5 years, but it can't. It's been trying to heal, but it can't heal. Okay? And now we're removing this material here inside the annular tear, known as the herniation, the nucleus pulposus. We're removing it so that the disc will heal. But even though I do my part of removing the nuclear material so that the disc will heal, the disc still has to heal. And that healing process doesn't happen overnight. It literally takes 6 months to a year to completely heal. So I tell my patients, you have to gradually, this is a big piece of herniation, by the way, you have to gradually increase your activities. My God, this thing is big. I can't get it out as one piece. It won't come. So I'm going to have to take it out bit by bit. I was trying to get it out with a laser, but it's too big. Look at this thing. Oh, mama. That's, again, pieces. Why? It's just not possible to get it all with one grab. So what did I do? I actually shoved it from the foramen where it was, hitting on the nerve. Oh, yeah, there we go. All right, let's get a picture of this. Get the light on for this one. Can you see this? Can you see that herniation right there?
Yes, we can.
This is what every neurosurgeon loves to see when they take a herniated disc out. Look at that thing. Look how big it is. Put your thumb out. Look at this. It looks like a little blue caterpillar crawling along Sam's thumb. All right, Send it to the lab. That's it. That's like 80% of it right there. I'm not going to just, high five and get out of here. I'm going to make sure I get all of it because it was a pretty big one. And if I leave it here, she's going to still have problems. So I got to do a thorough job. By the way, there's nobody in West Palm Beach that does this surgery. That's where she came from. There's nobody in Florida that does this surgery. There's nobody else in the United States that does it like this. And there's nobody in the world that does it like this. So she came to the one place where you can get this type of surgery done properly. Now there are endoscopic surgeons, endoscopic spine surgeons that do transforaminal surgery, but what they do is they take herniations out and only herniations out. They don't understand about the annular tear. They don't repair the annular tear like I do. That's unique to the Deuk laser disc repair that we do here. So sure, I can take a herniation out, but that's not going to fix her back pain. The only way to get rid of her back pain is to repair the annular tear. It's called a debridement. And the Deuk laser disc repair you're watching now is the only surgery in the world that does that, and this is the only place in the world to get it done. And that's in 2020. 5 years from now, if more people are watching our broadcasts and they start doing this kind of surgery, then maybe you can get something similar elsewhere. But the truth is that unless I train them personally, you're not going to get the same surgery and you're not going to get the same results. So what's nice about this surgery you're watching is in 14 years of surgery, over 1,100 surgeries, we've never had a complication, not one. Not an infection, not a blood vessel damage, not a nerve cut off or anything like that, spinal fluid leak, nothing. This is the safest spine surgery in the world. It's the only spine surgery in the world that does not have a complication. Can you get a complication? Sure. If I'm having a really bad day, maybe I'll do something inadvertent and have a complication. But it hasn't happened yet. It hasn't happened in 14 years. It hasn't happened in over 1,100 surgeries. So what's the chance it's going to happen? Sure, it can happen. But I can tell you the chances are less than 1 in 1,100. Now that's patients, by the way. For each patient, I do an average of 2.5 discs. So let's just say 2 discs to make it easy. If I've done 1,100 patients with an average of 2 discs per patient, now some patients are 1 disc, some patients are 3 discs, some patients are 2 discs. But the average is 2.4 discs per patient. So if my average is 2.4 and I've done 1,100, I've really done 2,500 discs. That's an estimate, of course. In 2,500 discs, 0 complications, there's no surgery in the world that's safe for the spine than the Deuk laser disc repair. All right, we're almost done. I need about 2 minutes. So I'm outside right here at the disc. I'm getting to the outside. The epidural space is at 12 o'clock. She's going to be feeling it because this is where all the pain fibers are. Okay? I'm almost done. I need about another minute. So as long as you're okay with where she is, I'm okay with where she is. We're almost done. Just lay still. You're doing great. Look at all the scar tissue, this white stuff. This is just layer upon layer of scar tissue. This has been going on for years. The scar tissue comes from inflammation. What is the question? You're doing great. We're done. I'm just putting the last touches, the final touches. We got a big herniation out. She okay? She's all right? 30 seconds. You can see the end plate of S1 over there on the right at 3 o'clock and the end plate of L5 on the left at 9 o'clock. All right, let's just take a look. There's the nerve root right there. Oh yeah, I'm sorry, I know it's uncomfortable. I'm just showing our audience so you can see there's no pressure on it. We've decompressed your nerve root. 10 seconds, we're done. Done, done, done. And how many people want to bet me that her pain is gone? Anybody? Thank you. All right, here we go. Take a look over here, and I'm going to show you what the whole surgery. We're done. Everything's good. Hold that for me. Sean, can you see? Go ahead.
Yes, we can.
All right, folks, for those of you who have never seen the endoscopic surgery of the spine, we accessed the L5S1 disc. So the disc was way down inside. We went into the disc through the foramen, and I did the whole surgery through this skinny little tube. It's I call it my milkshake straw, but that's what it is. And hey, here's the herniations we took out. Luis did the artwork here. I like it. Beautiful. That's what the patient's face will look like at the end of surgery. Thank you. Great job, guys. All right, let's look at the incision. Can you see the incision here, Sean?
Yes, we can.
All right, the whole surgery was done through that little cut, and it was done with this most amazing endoscope. All right, a little pressure. Let's close it up. You did it. We're all done. Your pain's going to be gone. It's going to be amazing. Duke Spine Institute. Thank you, everyone. Great job. I'll come answer questions, so go ahead and type them up.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. As you know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain
Okay, Dr. Deukmedjian here, and Sean and I are going to go through some of the questions that our viewers have typed up on different social media platforms. Go ahead, Sean.
All right, our first question comes from a viewer on Periscope, JN. They ask, how many surgeries do you do in a day, and what is the max you've ever done?
All right, well, someone is asking Dr. Deukmedjian, how many surgeries do you typically do in a day, and what's the most you've ever done? Well, great question. So typically I do anywhere between 2 and 3 on a day. Sometimes we get up to 4 or 5. The most surgeries I've ever done in a day were 6. And of course, when I'm doing 6 surgeries in a day, some of those are easy ones. They take like 5 minutes, like carpal tunnel release. If I'm unpinching someone's, carpal median nerve, it's called a carpal tunnel release. It literally takes me 5 minutes to do. So if I have a carpal tunnel release and then, 1 level fusion or a 1 or 2 level Duke laser disc repairs, I can probably get about 5 in a day. In the state of Florida, surgery centers are limited to discharging the patients on the same day. That's by midnight. So it's not like some other states where you can keep the patients 23 hours and make sure that you could send them home the next morning, basically. We can't do that in Florida. I mean, you can do it if it's an urgent situation, but we've never had to do that. Our patients are always out of here by 8, latest 9 o'clock. The posterior cervical fusion we already did today. She's getting ready to walk out of here. And then the laser surgery we just finished will go home in about 30 minutes. So you have to always be careful as a surgeon that you don't wear out your team because, they start early and you don't want them to go too late because then people can start making mistakes. Like the nurse can make a mistake, I could make a mistake, the technician can make a mistake, somebody can make a mistake. The more tired they are. So you really don't want to do too many surgeries and have everybody here too late. They get angry with you, plus they get tired and the incidence of mistakes goes up. So we don't want any mistakes at all. I'm a perfectionist. Doesn't mean I'm perfect. It means I try to be perfect, but of course I always fail because I'm human. And all humans never achieve perfection, but we try. And so I don't like opening the door to bad outcomes because of circumstances that are fully within my control. And what that means is I will never put my patient in harm or jeopardy of having a problem from the surgery I'm doing as a result of me not being properly prepared or not taking necessary precautions to avoid those complications. So having not too long of an operative day is important to avoiding complications. And I would rather have a shorter day, do fewer cases, go home a little earlier, give everybody rested and fresh the next day, rather than try to squeeze out a bunch of surgeries and just to make more money or whatever. I don't think that's right for the patients, and I certainly wouldn't want it for me or any of my family members. And God forbid something bad happens, I would blame myself for that, and that's something that's easy to avoid as long as you're smart and cautious about it. So to answer your question, I've done surgeries, a surgery that lasted 18 hours. That was the longest surgery I did. That was not me. That was me assisting Dr. Roper at UF in Gainesville when I was a neurosurgery resident, and that was taking out a brain tumor at the VA. It took us 18 hours. That's only because Dr. Roper is probably the slowest surgeon in the world. And, I tried to kick him in the pants and make him hurry up, but he doesn't listen. He literally will take one tumor cell at a time with his sucker and bipolar. I've never seen a man honestly, he would pick up every grain of sand or dirt on the floor with his finger or a tweezer. That's the kind of guy he is. I just get a vacuum in there and suck it up. In the end, it's the same result, and it takes a lot less time. It's better for the patient. So I've done 1 surgery in a day that took 18 hours all day, and I've done 6 surgeries in one day. And the time I did 6 surgeries was very rare. I only did it one time in my career. I've been doing this 22 years now. So I think that answers the question. Do we have any more? I would just say we're going to wrap it up today. We've done 2 surgeries. This last one was a single level Duke laser disc repair. We will be broadcasting her, hopefully, if she allows us, to broadcast her in the recovery room. And she'll tell you how she's feeling after her laser surgery that you just watched. I don't know if she'll agree to it, but if not, we'll get her tomorrow when she comes in for a checkup. And I would just say download the Duke Spine Institute app onto your phone. It's free, no charge. We don't have any advertising in there. There's no tracking or anything we do. It's literally just an asset for you to use to learn more. Also watch live surgery or submit your MRI for review. And we have a Facebook group called the Spine Surgery Support Group. And that's for anyone that's interested in learning more about spine issues, like neck or back issues. And you're welcome to go in there and post a question. We discourage people from advertising in the Spine Surgery Support Group. It's not an advertising platform for vendors or people trying to sell things. So if you go there and you try to post an advertisement, it won't be allowed. But if you want to post a question or comment about something about the spine or spine care, or even insurance or anything like that, we'll be happy to answer it in that community. Once again, on Facebook. We are now broadcasting live in multiple social media platforms. We've included now YouTube, Twitter, which is Periscope, Facebook, and LinkedIn. And we looked at adding Twitch, but they won't allow blood and gore, so we couldn't do Twitch. Instagram only wants short videos. These are very long, so they won't let us. Anybody has any recommendations for other live streaming platforms that we should consider integrating into our show, then we'll be happy to consider it. Other than that, we may be back here next week doing some more surgery on Tuesday. And I think that's all we have to say, right? Oh, we're working on a VR project to bring the very first VR live stream, virtual reality live stream. So if you have a Vivo, right, headset or an Oculus headset, I think there's 4 platforms. Any of those, we will be streaming live where you could put on your augmented reality headset and look around the operating room. We're in the process of developing the tools for doing that. That's probably going to be available in about 2 months during surgery. So Duke Spine Institute is trailblazer in not just surgical technique and outcomes, but also in the technology related to teaching from the operating room. Have a great day. We'll talk